Hi guys, welcome back to the channel. Today we will be discussing about classification of top shock and we'll starting with hypovolemic shock. Okay, let's start. Classification of shock based on initiating mechanism. First is hypovolemic shock, second is cardiogenic shock, third is obstructive shock. Okay, cardiogenic and obstructive is correlated. We will see in detail. Distributive shock. Under distributive shock, there is anaphylactic shock, septic shock, and neurogenic shock. And last one is endocrine shock. So broadly, there are 5 kind of shock: hypovolemic, cardiogenic, obstructive, distributive, and endocrine shock. Under distributive, there are 3 kind: anaphylactic, septic, and neurogenic shock. Now coming to hypovolemic shock. It is due to decrease in circulating volume. What causes hypovolemic shock? There is decrease in circulating volume, which means this is due to sudden loss of fluid from vascular spaces. Sudden loss of fluid from vascular spaces. It is the most common type of shock. It is mainly due to 2 reasons: hemorrhagic causes and non-hemorrhagic causes. Okay, what are non-hemorrhagic causes? This is poor fluid intake, excessive fluid loss, evaporation or third spacing, यानी moving out of the fluid. ठीक है. What are the features? There is decrease in systemic arterial pressure. There will be tachycardia. Cardiac output is decreased. BP is decreased. Vasoconstriction will be there, and there will be cold, clammy extremities. Okay, this is all hypovolemic shock. Under hypovolemic shock, there is hemorrhagic and non-hemorrhagic. These are all of non-hemorrhagic shock. Okay, what are hemorrhagic type? Hemorrhage mostly occurs from the systemic venules and small veins, 50% of the total blood volume. Okay, hemorrhage occur due to systemic venules and small veins. Okay, okay, what happen in hemorrhagic hypovolemic blood shock? Loss of blood will be there. Then there will be decreased filling of right heart, which leads to decreased filling of pulmonary vasculature, which in turn lead to decreased filling of left heart. So left ventricle stroke volume decrease by a mechanism called Frank-Starling mechanism, cause drop in arterial BP. All this will lead to drop in arterial BP, which will eventually lead to shock. Okay, what are the clinical features? According to the degree of loss of volume, clinical features are determined. First is compensated, mild, moderate, and severe shock. Okay, these we are talking about the hemorrhagic type when there is loss of blood. In non-hemorrhagic hypovolemic shock occurs due to fluid loss mainly or poor fluid intake. Now compensated. In compensated, loss of volume will be no blood volume will be lost because there will be prolonged capillary refill time. In mild, there will be less than 20%, in moderate 20 to 40%, and in severe there will be 40%. Lactic acidosis present, here also present, here highly present in severe. Okay, now urine output will be normal in compensated shock. In mild, it is normal. In moderate, it is reduced. Less than 0.5 mg per kg per hour. This is called oliguria. And in severe, there will be anuric. Okay, no urine. Now conscious level is normal in compensated shock. Mild anxiety will be there in mild shock. In moderate, there will be drowsiness, and in severe, comatose stage will be acquired. Okay, now RR, that is respiratory rate, will be normal in compensated shock, will be increased in mild and moderate, and will be labored in severe shock. Okay, now pulse rate, there will be mild increase in compensated. There will be increase both in mild and moderate. In moderate, there will be less than 100 beats per minute. And there will be increased pulse rate in severe also. Okay, normally pulse rate increases in all. Okay, now BP will be normal in compensated shock, will also be normal in mild shock, but in moderate and severe there will be hypotension. In moderate there will be mild hypotension, and in severe there will be hypotension. Okay, these are the criteria for clinical features of hemorrhagic hypovolemic shock: loss of blood volume, lactic acidosis, urine output, conscious level, respiratory rate, pulse rate, and BP. Okay, in mild we have already read that in non-hemorrhagic type of hypovolemic shock there will be cold and clammy extremities. Same here, in mild shock there will be cool and sweaty periphery, and patient will feel thirsty. Okay, at this stage patient will feel thirsty and the extremities will be cool and clammy. Okay, we will be seeing the compensating mechanism of hypovolemic shock in the next class. Till then, like, subscribe and share. Bye.